Okay, good morning, everybody. I would like to call to order the Public Health Committee for Wednesday, October 22nd at 9 a.m. I'm Cheryl Strathman, the chair. Clerk, please call the roll.
Arroyo. Juby. Over here. Genesis.
Hennis is here.
Harvard. Is he online yet? Young. Sanchez. Strathman.
Strathman here.
Roth.
Roth is here.
Okay, thank you, Mr. Roth, for being here.
You're
So we
welcome.
now have in-person quorum. I heard a message somewhere. Oh, I would like to start today to say that today is International Wombat Day. You would all like to know. So that
Here's your mic. I thought you said Walmart today.
Wombat. Wombat Day. Yes, yes.
I don't know. You haven't been to Walmart lately.
Now, we do have a remote request for Mr. Tarver, but I don't see him. I think he's at a meeting, so he may be joining us, but when he does, we have any objections to him joining us?
No problem.
Okay, thank you. And we have no public comments this morning.
Okay.
I would like to ask for unanimous consent to approval of the minutes of September 17th, 2025.
Hennis moves for unanimous consent for minutes of September 17th, 2015.
Any
2025.
objections? Okay, great. And so I guess we'll get right to business this morning, which is, well, the reports are on file if you have any questions. And then, good morning, Mr.
Good morning,
Yuksad.
everyone. I have a presentation for you this morning, which is always fun. Our vaccine clinic, our last clinic was this past Saturday for the 2025 season. We're very excited because it was season 11 for us since I have brought these back. It is still the drive-through clinic style. Here's two of our friends from this year alone. The drive-through style has been fantastic with keeping animals distance. We don't have as many animal fights, animals getting loose problems. So it is really keeping better. And I got to talk to two lovely people this year, and one was at this last clinic. This is their first time coming. They thought this is the coolest thing they've ever seen. They love that they didn't have to get out of the car. We came, we took their money, we took care of their animal, we did everything. They just got to sit there at a low cost and drive off. So it really has worked out great for people. I didn't want to ruin the picture.
Oh, no.
Oh, just making sure.
No, sorry.
At the end of this year was clinic number 60. So we've officially done 60 clinics. As you can see, we started at 2, went to 5 to 7. We learned that 6 really is our sweet spot, except for the COVID year. We had to only do 4 because we lost 2. But we just completed 60. And we're very excited about that. Per Illinois state law, we do have to do at least minimum of 1 microchip clinic per year, centrally located in the county or at our facility, which our facility meets both of those. So it's perfect. And because we're also responsible for registration of rabies, we also do the rabies at a low cost fee to help the citizens of King County to ensure that they're compliant with the law.
Can I ask you a question before you go on?
Sure.
Do you register for the rabies at the drive-through clinic as well?
Yes, when you get a vaccine, you must get a tag at our clinic, so you're automatically registered. And same thing with the microchip. If you get a microchip, we ensure that every microchip our facility gives out is fully registered with 24-hour pet watch, because that's the microchips we use at this moment. So every microchip is fully registered at the moment you get it from us. So that $15 not only includes the implantation of it, it also includes the registration. So those animals are fully registered with 24-hour pet watch.
So one-stop shopping for all.
Exactly. We make it as easy as possible on people. And part of the reason we do the registration is I pay a little bit more for my microchips to be able to do that. It's important to me to make sure these animals are registered, because that's the whole reason we're putting the microchips in them. I want to ensure that that animal has a link back to its owner. So to us, it's worth taking the little bit of loss in the revenue to ensure we're doing what's right by these animals.
I got a question, Brett. What is the percentage of vaccinations that you conduct as opposed to all the vets out there in King County?
Around, and this is rough off the top of my head, we did 698 vaccines this year compared to around 24,000 roughly.
It's a
So
lot of
it's a small percentage, but we're trying to do our part to hit those people that really, this was designed for those people that can't afford it. Because it's $50 plus to walk into a vet, then it's 50 plus for the vaccine, then it's this. We want to ensure that you can be compliant with the law at the most reasonable, effective price possible. And that does come at, because again, we're not a profit-making business. So and I'll show you the numbers here in a minute. The clinic pays for itself.
The senior discounts, to the vets give those senior discounts?
Yes, they do.
Okay.
If they're selling a registration tag, it's the same it's the same fee that they charge that we charge. We give them a price sheet so they know exactly how to charge for them.
Thank you.
Of course. This is a total quick graph. So you can see that our numbers continue to grow every year. For us, it's real big in the cats because it's hard to convince people that cats need rabies. Cats are one of the most important to rabies because bats get into our house. Bats are the biggest carrier of rabies. So it's very important. So we continue to make that push every year to get our cat numbers up, and they do continue to grow, and we're very excited about that. Again, this is just a write out. You can fully see how the numbers have grown for both the dogs and the cats. We do promote this through Facebook. We put it out through all the senior services group. We put it out through Julie. Thank you to everybody who helps us get this word out throughout the year. We put it into local libraries as well too, to make sure that it reaches the people that we're really trying to reach. Just focusing on dogs, now we can see as our numbers continue to grow every year, and here's the breakdown of those numbers. Again, our biggest focus is into that senior number, and that number was up to 224 this year, which is fantastic. That was 40.43% of our dogs alone was in the senior group, and that's what we really try to push for. When we look at that $10 fee that had to be added to the non-neutered, I wanted to put this in so you could see that that percentage, state law says that neutered animals versus non-neutered, there must be a minimum $10 differential. We learned 2 years ago now that we were not compliant with state law. So we got that corrected through an ordinance, and that says that seniors, to ensure they still get that free tag, we had to say the neutered was completely free, the non-neutered became $10, and that's to ensure that we are compliant with that state law. And what we mean by senior is human pet owners, 65 years of age or older, because a lot of people do believe it should be senior dog, not senior person. Looking at our cat numbers, like I said, we had a little dip last year, made us sad. So we continue to make that push into the kitty cats, and we're growing that number fantastically. Again, we can see that that senior number especially dipped a little bit this year, but we do continue to push for those cats to get in and get vaccinated because it is so important.
Mr. Youngstead,
Yes,
could
I'm
I
sorry.
ask you to slow down on your
Oh, of
slides?
course.
Just
Sorry.
because I'm wanting to look and you're going so fast,
Sorry,
so,
I get excited.
so,
And when we look at the senior numbers, that's 62 this year. We have the breakdown. Only 2 of them were in that non-neutered group. The reason I wanted to emphasize this is to show that that $10, the majority of our population of seniors are still getting that free tag. And that is what we were trying to do. We weren't trying to make money off that $10. We were just trying to ensure that, again, we are in compliance with the state law. Microchip numbers, we did not expect this to continue to grow every year because we have a lot of repeat customers, which is fantastic. We have gotten to see puppies grow over the year, over these 11 years, which has been a lot of fun. We get to see people with new animals that keep coming back to us. So it really has been fun to see these people. We expected this number to really level out about 100 a year, which is about where it's at. Sorry, please.
Got a question regarding the microchip. There was a company that went out of business, and it's going to affect those people. Do you have any idea?
For the
do you have-
microchips?
Yeah.
Yes, and it has already caused trouble for us trying to rehome an animal back or to find out who an owner was. It was a smaller microchip company. They went out of business, and usually they sell their data to a larger microchip company. This company took the choice. It's an Amazon company. Took the choice to just close up shop and delete their data list. So there is a group out there with microchips that are not used. Those are not chips that we use or would use. So we're good with everything we've ever implanted. But yes, we've already had trouble locating an owner because of that very thing with that microchip. And
that's
it,
too
yeah,
bad.
it's very frustrating.
Yeah.
That's the whole benefit of putting these in. There's also some other counties who give the microchips and don't register them, and then the people don't want to pay $20 to register. And so we've had issues with that as well too, which is why it's important to us to ensure we're doing the right thing. The revenue. Like I said, the revenue continues to grow every year. This is because our numbers grow every year, and also the tag fees. The 2023, we passed that big Our last tag fee correction, which came into 2024, so that number is why it's a jump there. Again, in 11 years, it's great to look at this and go, oh my God, this year alone, you made $20,565. Well, when we spend about $18,000 on the clinic alone in overtime costs, fees, et cetera, the other $2,000 is balanced out with all the extra water and electricity because the facility had to be open 4 Saturdays and 2 Wednesdays later than it normally is. So really, it is meant to pay for itself. And this is what I mean. It's great to look at this number and go, yay, over 11 years, we've made $100,000. But in reality, I built this clinic to ensure that this is never taken away from this county. It pays for itself. It is meant to pay for itself. It is not meant to be our big profit making. If that's something the board would like to discuss down the road, we can, but it was not designed to be a profit in any way for our facility. It was meant to ensure that this is self-sustaining so that this program does not get taken away. I hope that makes sense. And then, are there any questions?
Yes, Ms. Juby.
I have a couple because I wanted
Oh,
to
sure.
see if they were going to be answered, which they weren't.
Sure.
Which is not because, no, yeah, okay. So when you give the vaccines to animals in the drive-through, do you guys take the animals out of the car or do you do it in the car through the window?
We take them out of the car and we bring them into the facility.
Got it.
Away from the owners are usually a lot easier to handle. Now, there are owners that will come in with their pets. What we tell every owner is speak to the group when you get to the front of the line if that's something you'd like to request, and they'll see if they can accommodate you.
Okay, great. Thank you. And then when you talk about Pet Watch, who I've never heard of, so I'm thrilled that there's another player out there because exactly what you said. Is there an annual fee after the first year for the owners, or does this cover the registration till the dog dies or the cat dies?
With the 24-hour pet watches that we use, we cover the first registration. So whatever address and phone number you give us is what is entered for the life of that microchip.
Wonderful.
If you want to update it with 24-hour pet watch, they're going to make you pay a small fee to
Got
update it at that point. What we've told people is if you move or change phone number, because we are also registered on every one of those microchips, call us and change it in our system.
Okay.
Because the first phone call is always to an owner and we do the same thing.
Yeah.
Phone call number 2 is the implant facility.
Yeah.
So everybody does the same thing for us. So we can say, hey, we have an updated phone number. We have an updated address so we can ensure that the most correct information stays with that microchip at all times.
Great. That's really good. We registered through AKC because it's a
Oh,
lifetime,
yes.
but we did home again or home, whatever.
Yep.
And it's every year.
Yep.
And it's like,
Certain companies do
yeah.
charge different fees.
So I'm glad this is a lifetime. You had a chart that you went by very quickly, a
Sorry.
bar chart. No, it's fine. Where it talked about your neutered and non-neutered. So it's your vaccine. No, it's the next one that breaks it down between whether they're okay. Not the seniors, the neutered, non-neutered. Is that cats or is that dogs?
Cats.
That's cats. Can you do dogs?
Sure can.
Okay. So it appears that the non-neutered stays pretty steady with the amount of dogs that are non-neutered.
Let me just fast forward one slide. So yes, if you look at the non-neutered row, it's pretty consistent through, I would say averaging about
Right.
70.
So do you think that's because of the extra cost, or do you think that's because people who don't neuter their dogs tend not to do vaccines?
We're in a generation right now where I'm going to say a majority of the people have neutered pets. Most pets, most.
I don't.
Well, most, and that's why I say most. I'm just very cautious in that. I'm not against, or excuse me, I was talking about 3 years for a second. I think it's just the way the percentages are with animals. Because if you look at our overall numbers, when we enter tags in the year, you're going to see that the non-neutered rate is just that much lower.
Okay.
The majority, I would say at least 70% have that neutered pet.
Okay. I'm just concerned about, like, I don't have neutered dogs because I may be breeding my dogs, or showing my dogs. When that window passes,
Oh yeah.
they're losing it. However, I just am concerned that maybe people who have non-neutered dogs are not seeking vaccines for them. And that would be the market that I would be concerned about. I don't care if you neuter your dog or not neuter your dog. I do care if you don't vaccinate your dog.
Right.
So I just wondered if there's a way, if you have any indication. The fact that it's consistent is a good thing, but maybe not, because I don't know that the number of non-neutered dogs is staying stagnant.
I have not heard from myself or any colleagues in the
Okay.
counties that having a neutered versus non-neutered, because we're consistent with every other county.
Okay.
That they've had an issue that the fees are what holding people back. It's usually personal beliefs.
Okay.
More than price.
I just
So
wanted to make sure that people who had non-neutered dogs were not passing by vaccinations because it was more costly.
I'm sure there's always going to be those people that
But
are,
they're
that are
outliers,
going to be
right?
out there.
Yeah. Okay.
But again, when we look at the overall numbers, it matches up on the yearly totals of all of our tags. I would say it averages pretty correctly.
Okay. Thank you.
Of course.
You look across at neutered, non-neutered senior, those all jumped, those look like a pandemic jump with the number of pets increasing. That's when the jump was. Otherwise, it's been pretty consistent. But it went
For
from
the
28 to
seniors?
59, 130 to 176. It jumped, from 2019 to 2020, it looks like.
Oh, yes. It was also marketing. We tried,
Okay.
as we were building this, we've tried different things. For a couple of years prior to COVID, we did Facebook. And we would set it for all of Kane County and we'd blast it throughout the county. And then we've tried other digital marketing methods through TikTok, through Facebook, through whatever's out there now. Sorry, I'm not a huge social media
Either.
person. But we are trying to blast it every direction possible, trying different groups. That's why we want to, at the senior group, which has been fantastic. They do a great job of ensuring that they get it out to all the senior events too, because that's, again, our market we're trying to hit. Libraries were fantastic at helping us get it posted. So all we had to do was email to them. They'd post it up in their display cases. Again, trying to reach the community that we felt most needed these services. If anybody has suggestions, please don't hesitate to let me know. I'm always looking for new ways to get this out there. We do want to continue to grow this every year as much as the staff is already spinning in circles during the clinic. If it's in demand, it's in demand, and maybe we look to extend hours, add days, things like that as we go. So that is something always to consider. But thank you.
I would recommend that everybody go see this clinic. It is just amazing to see, and the people just love it. They just love it, and the line goes out to the road.
And it did again, this one made it just past the solar panels, and we get faster every year, meaning we get better moving people through the line. So from the solar panels to the front of the line was only an hour and a half this year compared to 3 hours when we started. So we are moving at a better pace. It gets better every year. There's still new people that don't expect the long wait, but for $15 rabies, you have a lot of people that want that service, and the lines, especially on Saturdays, get pretty long. But we do our best.
Yes. Mr.
So
Dugan.
I'm sorry, one more. So going back to how you get the word out, have you considered like reaching out to the local school districts, the local daycares who serve it to have like small children, which would definitely benefit a parent to have somebody come get their dog or cat out of the car as opposed to traipsing their children into the vet clinic. But I know that a lot of the elementary schools do a backpack that goes out on Fridays. So maybe you could get a digital flyer put in that. I know that some of the local daycares might be willing to have you post a flyer there or disseminate it through maybe their MailChimp or whatever, because I think that might be a market that is often overlooked. And having had 2 children under the age of 2, with 2 dogs, I would have loved for someone to come to my car on vet day. It would have, I would have paid more to have someone come to my car on pet day. So just some considerations, maybe.
No, I never even thought about that. It's a really good idea. and
Have
we
you
will
tried
definitely look
the
into it.
doggy daycares?
We have some resistance from some groups. The vet community, especially when 11 years ago, when we started doing this, we had a huge pushback. We're trying to be a partner. We're not trying to be a competitor. Those are businesses trying to earn money. I understand we are not. We are government. We are not a business. So I want to stay in my lane. That's why we only do the 1-year rabies. We only do the microchips. I highly encourage, we give out actually a large sheet. We have 2 pieces of paper at the end of the clinic. One is about vaccine reactions and what to look for. The other is about why, distemper vaccine, heartworm testing, Feluc FIV, heartworm treatment, all that stuff is so important, and you need to establish a relationship with the regular veterinarian. Whether or not people read it, I don't know, but we do try to ensure that we continue to promote that you still need to see a veterinarian, and you should be. Because again, we want to be a partner. We're not here to take away, and I'm not trying to steal business.
And you're interested in the health of the animals.
Correct. We're
Imagine
here,
that.
yeah, we want to make sure you're legal and you can be found. That's the two things our department's responsible for. That's my lane. I want to ensure that we stay in our lane as much as possible. So some groups have given us pushback when it comes to those things. That's the only reason it's been, that's why I didn't even think of the children though. That's a very good idea.
Maybe we could do that for children as well.
Yeah, I was
as the
just, well,
dogs.
that'd be great. Drive-through children pediatrician. That'd be
They
awesome.
take them out of your car, they bring them back.
Drive away for coffee and, oh, where are my children?
You would have to make sure.
We
the
had two
cars
people
don't
drive
leave.
away without their credit cards. So as much as I laugh,
Oh.
it happens at the clinic. There's so much going on that they just forget and they leave and we're standing there going, where did they go? And so my daughter had to chase someone down at this clinic and caught him at the road. So,
So like I said, it's a fun thing to watch.
yeah, there's a lot going on. It is a fun day. We encourage bringing your significant other so they can do a day volunteer. And so at least they're there with you. And we have stations that work great for our volunteers, the handing out the clipboards, the checking paperwork, while the staff handles the other duties. And it allows us to see so many cars. I mean, honestly, if it wasn't for these volunteers, I don't know how we do what we do.
So when's the next one? I think we're done for the year, right?
We're done for the year. So we're starting in January. We'll start to plan dates for 2026. With our new veterinarian, it should be a little bit easier to set dates this time through. So hopefully we can get the whole year set up front instead of in sections. So hopefully.
Very good. Any other questions? Is that the, all of your report?
That's my whole report.
Thank you, thank you. Well, now I'd like to ask for a motion and a second, and so we can discuss the resolution authorizing the acceptance and appreciation of artwork donated to animal control.
To accept the resolution.
Juby seconds.
Brett, would you like to tell us about this?
Sure. Blair, can you put up the picture? I'm sorry. Thank you. This is the image. Carolyn Barnard, and I apologize if I said her name wrong. I'm very sorry about this. This is a 16 by 20 acrylic. It is titled, oh, wait, I don't have it on this one. Shoot. I have in the resolution though. She adopted two, that's what it was. Thank you. She adopted two cats from us, Jack and Zelda, back in 2017. And they're actually the inspiration behind this because she believes in adopting, not buying pets. So this piece spoke to her and she thought of us immediately and wanted to share it with us. And we thought that this would be an amazing addition to our viewing room, because our viewing room is where you get to go in with these pets and sit and decide if they're right for you. And the animal also gets to decide if they want to be part of your family. That since that is what inspired her, we wanted to make sure we pass that on to future adopters from our facility. And we thought that would be a beautiful location to put this. So we're bringing it before you today to see if you would allow us to accept this donation.
And I didn't mention the number is TMP 25-1276. So any other questions or comments about it? It's so cute, isn't it? Yes, Mr. Greg.
Thank you. Is the cat smiling because he ate the other food?
Yeah, I don't know. It's a good question. I just thought it was really cute. And I love the story behind it of why she drew it, that it came from animals that came from our facility. So I thought it was just absolutely amazing that our animals were able to inspire this and hopefully it continues to pay it forward to others.
Kind of full circle.
Yeah.
Okay, any other questions or comments? Okay, would you call the
Or
roll?
maybe that's the cat she adopted and it's happy it's
Yeah.
out of it. Like,
Juby,
Juby, aye.
Genesis,
Genesis, yes.
Tarver, Strathman,
Strathman, yes.
Roth.
Roth, yes.
Okay, it passes.
Madam Chair.
Yes, Mr. Roth.
There is a nonprofit group, I think they're out of Aurora, that actually have artists do paintings and they put them up at different places. And if you talk to them, maybe they could concentrate on pets and then they offer them for sale as a fundraiser.
I'm hoping to one day get a hold of an arts group, either through one of the colleges.
Okay.
We would love a mural. In our facility, you actually walk through the first buzzer door to get to the adoptables, and then it's cats to the left, dogs to the right. And there's a big white wall basically. And we have always had the idea of getting a student in there to put a mural together for us. We just thought that'd be a great location to do that.
That's
So
another
if
idea.
everybody knows an artist that is willing to donate some time to us.
But this is a
Um,
nonprofit group
But
that,
no, I think that's
yeah.
a great idea.
I'll try to get the information. They have it out at Aurora.
Schools do that as well.
Yeah.
Libraries do that as well. Have
I
a,
just think it's a cute idea.
yeah,
So,
thank you.
thank you.
Okay, thank you for a great report. Continue the good work. And
Speaking
Oh.
of good work,
what was that?
speaking of good work.
Yes, now on to the next good worker. Good morning, Mr. Isaac.
Good morning, everyone.
Are you going to be as warm as fuzzy as Brett?
Yeah.
Unfortunately, in my career, we've learned that it is very hard to compete with cats and dogs. So no, I won't try even. I do have a couple things that I'd like to share this morning. And then I have some data I'd like to just look as we start planning for 2026 and the type of information we want to bring forward in our packets. I just want to share some types of data that we regularly collect just to see if you're interested in us including this in the packet. We can talk about what we want to talk about on an ongoing basis. I'm aware that packets can be 900 plus pages, so I don't want to just include a lot of things unnecessarily if they're not going to add value, or if people don't want, we can always bring things up on demand as needed. But first, we have a set of data, and thank you to Director Alleman and her team of epidemiologists. We have our birth records and our death records that we get from the state of Illinois. And this team's just done a fantastic job of summarizing, and based on some questions that we had received from Commissioner Young, just wanted to share like what's making people sick, how are people dying, and also on the flip side, what's happening with births in our community. So I'll just share a couple slides here, starting with birth data. So you can see this data, and I always like to point out with the information that we get, information comes from a lot of different places and it may reflect different things, right? We could look at who's being born in Kane County hospitals, and we can look at who's being born to Kane County residents. So this data here is reflecting births to Kane County residents. It is the 2023 data. It's the most recent data we have here. You can see a couple of things that stand out. Number one, I think the first question people ask, how many births are there? So just under 5,500 births in 2023. You can see what's referred to as just the general fertility rate. So that is an equation that's looking at the number of births per 1,000 women of childbearing age, which for this equation is 15 to 44. And so that is reflected on the orange line there. Of note, you can see that our birth rate has gone down pretty significantly over the past 25 years or so, with a 36% drop from 2000 to 2023. And I'll share, we're just sharing this data with you. We can speculate, we can talk about different things going on in the community. Sometimes there's limitations on the data. So this is just what's actually happening. And unfortunately, we lose a lot of babies in our community as well. So looking at this, you can see, and it's broken up by the blue is neonatal mortality. So little ones that we've lost in the first 27 days, and the orange is post neonatal mortality. So that's just past 28 days. So you can see that the rates have been going down, which is a positive thing. The Kane County Health Department's actually done a lot of work over the years around infant mortality. We see that a lot of the causes, so we see premature births and low birth weight really attributing to these deaths. But then there's a lot of things that impact prematurity and low birth weight. We see tremendous disparities in race. So we have seen in Kane County over the years, for example, the African-American birth rate or infant mortality rate rather, 2 or 3 times as high as that for the non-Black rate. So this is something that we work very closely. We have a lot of interventions in the community supporting families, but stress on mothers, even pre-conception, is something that has a large impact. And we see that racism is something that has a large impact on births. So we'd be happy to come and do a deeper dive on this. But just looking at this one data set, you can see over the years how it's been going. So for every 1,000 live births in 2023, we had 7.1 infant deaths. And again, just going back a slide, so there's about 5,500. So, when you multiply that by 5.5, that's how we end up losing about 40 little ones a year.
Question.
Yes, Mr. Roth?
Do we have, or could you get numbers like for other, the major
Comparisons?
counties and
Sure.
then the state, and I would even say national or regional even,
Definitely.
because I'm curious where we fall.
Absolutely.
Thank you.
Looking for,
Uh,
yes, sorry.
Two more
Genesis
questions.
has a question.
Looking like it's ticking up there a little bit at the end. It's dropped precipitously and now looks like it's going up again, doesn't it?
Yeah, so we have, and again, this data doesn't tell us the whys, and we actually have done some deeper dives. We participated in a project called Perinatal Periods of Risk, where we did a much more intense analysis of the data. So this is one data set that we're seeing here. Of course, one thing that was going on is COVID. So what are the stressors? What's impacting families, whether it's access to care, whether it's violence in homes, whether it's untreated mental illness and substance use, like there's a variety of pressures on families, but that's just me saying things that are happening generally in the community. That's not a definitive, this is what's causing that. But to Mr. Roth's question, and I think going along with yours too, we can continue to dig in and provide more data around this. But this is why I think one thing I'll point out is for all of our programs where, and I say this a lot, supporting families is not only the best thing we can do for the health of the community, but it's the best investment we can make in the future is supporting people before they have children so that they're ready when they do have children.
Sure.
Yes, Mr. Gripe, you had a question.
Thank you, Madam Chair. Two questions, actually. I would assume that miscarriages are in here as well, or no?
No, but I'll look to Director Alleman or Onwuda. They both have expertise in this area.
John, this is mortality, which means after the birth.
Right.
Around, yeah. So this would not include miscarriages.
Okay, all right. So my misunderstanding, because that could be indicative of some other things you talked about. And one thing you said that you found as a cause of infant mortality was racism. And I'm curious how you measure that.
Sure. And it's very challenging to measure. And there's some pretty good international data. And I think as Mr. Roth said, how do we compare? I think something that's really striking to me, and this is just a subjective experience I've had, but looking at actual data and studies is infant mortality in Africa. Then when people emigrate to the United States, that first generation for that Black person who's the first generation African-American, they have a much higher rate of infant mortality than their African parent would have had. And so when we talk about, well, what are all the factors that go in? So obviously when we look at something, when we do a deeper dive, like Mr. Pennis has said, we're looking at education, we're looking at income, we're looking at substance use, all of those things. When you take all of those across the line, we see much higher rates of African-American infant mortality than we do in other groups. And it's not genetic because we don't see that in Africa. We see that when people come to America and live here. And I'm happy to share much more information because to me, it's a sad, fascinating bit of
I mean,
science.
it's a concern, but I'm also want to deal with, like my church works on, the situation in the home,
Yes.
getting husbands to stay with wives.
Sure.
I know any single mom has a tougher time
Yes.
completing, pregnancy and all that. So that's very good stuff to look at, but we need to make changes to try and make it better.
Yes.
Yeah.
Yeah, absolutely. Absolutely. And this with this data, we're equalizing all of those things. So it's not that. That's not the cause, right? I mean, that's a fact. I shouldn't say it's not the cause, but that doesn't create the disparity.
Ms. Juby?
So it sounds like we're going to get this data.
Sure. Yeah.
When we get this data, is it possible to include the implicit biases of the healthcare providers?
Sure.
Thank you.
Thank you for that.
Can you define what you mean by that, Ms. Juby? I'm not
By
familiar.
implicit biases?
Yes, thank you.
So everybody has implicit biases. They're not always bad. They're sometimes it's just whatever. It's like how you view the lens, the world through your lens.
Right.
And sometimes medical providers have implicit bias against women. They have implicit bias against people of color and people that don't look like them or don't sound like them. And so as a result, the care that those people get from that particular provider is maybe not the same as it would be the care that they would get from a provider that looked like them or came from their culture or had similar experiences. And as a woman, I can tell you that when I have gone to certain doctors with certain things and they have been like, oh, well, you know, that's just your age now. And then I've gone to a female provider who is like, oh, we are going to go do tests on that. Or it's very, very different. And so I'm not saying that we should be attacking people that have different implicit biases than we are, but I think that we should recognize that implicit bias does affect a lot of things and a lot of people disproportionately from other people. And I think it's really important. So.
Thank you. That's a very, very
Yeah.
good point.
Thank you. Thank you for explaining that. And I agree. I think you're right on with that.
Very well stated. Thank you. And this is extremely well documented in science. This is not anecdotal. This is
Right.
very well documented. So we're happy to share. And it
Although
does
we
get,
all could tell you a story.
yes, yeah, absolutely. It's all based on, right. And to Mr. Greip's point, we want to find out how can we impact? What are the things that we can intervene? So there's cases where there's physician training opportunities or provider training opportunities. Societal racism, that's very challenging, right? That's poverty, that's world hunger, but we still want to be aware of it. Well, where are we touching these young mothers? Where are we touching these young families in a way that we can make changes through education, through training to provide better care, to reduce these numbers? Because we're one of the richest country in the world, and these numbers are much too high. And to Mr. Roth's point, when we compare it to other places in the world, there's no reason for this.
Mr. Linder, you had a question?
I'm wondering if the insured status of the mother plays a part in this as well.
It does, certainly. Access to care, access to first trimester care, all of those things play in. It's not the key when I talk about disparities. And so should separate these things. There's a lot of factors that influence low birth weight, prematurity, et cetera, including access, including what's happening in the home. But when we talk about disparities explicitly, those disparities exist even when we take all those things into account. So yeah, great question. And we'll come back with more.
Again, you guys, great discussion.
Yeah, very good. Maybe people are better than cats and dogs. This is good. Yeah, I like it. Yes. So looking at all cause mortality, you can see, and again, just starting with the big number, how many people die, how many Kane County residents die each year. So you can see the most recent year here in 2023, we had just over 3,700. You can see, looking at the chart, that there was a sharp uptick at the onset of COVID. We're slowly lowering back down potentially to more normalized numbers. If we were going to look from 2014 up to 2023 without COVID, maybe we would be getting closer to being back in line with that. We have the number of deaths is what the blue bars are representing. And then the orange line is age-adjusted mortality rate per 100,000 residents. So this is something when you look at causes of death across populations, you have different things happening with different groups. So different ages, if you're older, you're more likely to die of cancer. If you're younger, maybe you're more likely to die in a bicycle accident. So when we look at age-adjusted rates, this is the fine work that our trained epidemiologists do at the health department. It just kind of evens it out so you can look at a broader population and see what's happening. So the mortality rate, or the number of people dying, that rate is slowly going down after that first worst year of COVID. Questions on this slide?
Yes, Ms. Judy.
Right, I'm like, this
Kane
question
residents.
today.
Yeah, these are
Um,
Kane
Not
residents.
deaths in Kane County.
Correct. These are Kane residents.
So I know that the coroner had said that there's people that die outside of King County who are King County residents and people that die inside of King County who are not King County residents. Is this actually data? If a King County resident died in DuPage, their death would be included here?
Yes, correct.
Okay,
And I don't
great.
know, Liz, do you want to say a word about the source of this data? But yes, the answer to that is yes.
Essentially, this is from all of the death certificates in the state of Illinois, but also nationally. So as Michael pointed out, the most recent data we have are from 2023. It's because the state of Illinois has to collect everything from around the country, compile it, standardize it, and then we get it back. So that's why there's a little bit of delay in that. But yes, it does include everybody, regardless of where they passed away.
And then, and you mentioned, and it's an excellent point to always bring up is whether it's this data or other data, we may have differences with the coroner's office because it's potentially, and we have different data sets too with our hospital data. So that's part of why I didn't send these slides out ahead of time, is because there's context that really matters for all of these things. So it's better to have a conversation because it's very easy. And we saw it in 2020 where there was a lot of conflict about different numbers when actually people were measuring different things. So it was appropriate that the numbers were.
Mr. Roth?
Sorry, Roth here. Two things. I mean, in 2020, a lot of the additional deaths was due to COVID, I would assume, right? Okay. And then you categorize it like, drug overdose,
I'll
et
do that, yeah.
cetera. I'd be curious on the breakdown of that and what percent, because, are we increasing on drug death? Are we decreasing or?
Sure. And so great question. And I'll provide more data
Oh, see,
in
look at
a
that.
future meeting. So this is just looking at this one. And I tried to keep this presentation short. So this is just looking at 2023 data. But I think in both cases, we can show some more trend data with some of these things. So for 2023, what is the manner of death? That's the pie chart on the left-hand side. So you can see over 90% of people, it's what we call natural causes. Although, that can be a bit of a misnomer because our behavior as humans certainly puts us at risk for dying much earlier of quote unquote natural causes. But you have accidental deaths, suicide, homicide, and the small percentage there that is undetermined. Over on the right, you can see the numbers for counts for the underlying causes of death. So cancer for about the past 15, 17 years, I think cancer has been the #1 cause of death. Heart disease, second, stroke, accidents. Again, depending on age, and we're talking about there's a measure called years of productive life lost, where we can look at, if you're 90, 95 years old and you pass away from cancer is different than a 13-year-old who dies in a car accident or something like that, right? So we can dig in more in that. For all of these things, and this is a big part of what we do in our community health assessment process and our community health improvement planning process. If chronic diseases show up, and this current year, we don't have it explicitly called out, or this current cycle, I should say, but typically we'll have the conversation of, okay, if we identify heart disease as an issue that we want to tackle, well, what does that mean? Are we looking at how we're managing care? If people are seeing a cardiologist and that's how we're going to reduce deaths from heart disease, are we looking at the antecedents to heart disease to say, okay, well, smoking, physical inactivity, obesity, poor nutrition, these are things that we want to look at, which typically that's the path we've gone on, is we've said, let's look upstream. So we could look at diabetes management that's going to helpfully protect your heart later. But it's, in all things, prevention is much more effective, harder, but much more effective to do.
Yes, Mr. Penesis.
So it's kind of striking when you look at those numbers, cancer and heart disease, it's almost tripling what #3 is, it's stroke, and then going down the list. And yeah, prevention, obviously, big key to bring those numbers down, research into those as far as how to address these particular diseases is being cut right now. And that's concerning when you see these numbers and you see this research being cut. we need to keep that research up and how important that research is
Absolutely.
shown right in this chart right here.
Yes. Mr. Roth?
I like this, but and that's why I think we need to have multiple years, because if all of a sudden our priorities need to shift, because didn't heart disease used to be number one eons ago, and now it's, now it's not. So that shows what we've been doing, but we need to concentrate where the most.
Mr. Greif?
Thank you, Madam Chair. Yeah, looking at this, I just did some quick math. 49.8, so 50% of deaths are cancer, heart disease, and stroke. That's good news, I think, in what I need to point my finger at to try and treat this. So we can analyze it till the cows come home, but cancer is somewhat preventable. Heart disease is definitely preventable. And stroke, I think, too, people recognizing it, not dying from it. So if I was going to put my resources and my money and my time into something, those three are the ones, because especially, thinking about this afternoon, and we're increasing some taxes and doing some things like that that are hurting people that have little income. And those people have a tendency to buy food that's cheaper, which is garbage usually, and it's not their fault. They just have limited. So anything we can do to say, like on a limited budget, how do I eat healthier than the world wants me to? I'd love to see a campaign like that, just helping everybody in Kane County learn to use the limited resources they have to eat better and take care of it. Walk, stuff like that would be awesome.
Yep. Yeah. Great comments. Thank you. And I think as we look at this, a couple points I'll make. One, as I mentioned before, and we'll provide the data on years of productive life loss, because we all die, right? So if I'm 100, I'm going to show up on there, and you may not be sitting around saying, oh, how could we have kept Mike from dying at the ripe old age of 100, right? We're all going to die. So we really want to invest in, where are people getting sick? Where is that quality of life diminishing for people? And where are we losing people too soon? And I think to your comments, and I've pushed back against Mr. Young a little bit, or not really pushed back, because I'm in agreement with what you're saying, but also and not picking on a particular company, but a McDonald's advertising campaign just targeted in Kane County is probably 1,000 fold more powerful than any campaign we can push out to say, eat your fruits and vegetables, walk where you need to go. The evidence really shows that we need to change the environment where people are, which includes changing the food environment. And we as government at all levels, we make choices. So we've just cut SNAP benefits, which gives people access to healthier foods. We have done a lot of work with farmers markets and different things. It's one nice thing with having a mix of agriculture in our community, where we've tried to make access to local foods, including growing more specialty crops in Kane County available. The fact, and this is a really important point, the link between poverty and obesity, or food insecurity and obesity, which we've talked about before, seems like it's inverse. The less access to food you have, the more likely you are to be overweight, because people are, and you said it, are eating these empty calories. That's not, and I have a master's degree in nutrition. I have many years experience in this, working around the country. That's not an educational thing. That is, I can get a Big Mac for 90 cents, or I can get an apple for 90 cents. Our structure for how we provide food in this community is really challenging. So I agree with you that there's a lot more we can do, and teaching people how to cook healthy foods, there is an educational component, but we're talking about millions of people in our country, that it's not just telling people to eat healthier.
If I may, I think you're onto something, Michael. Because I know I eat at McDonald's occasionally. I try not to, because of what it is.
Convenient.
But I know my wife and I both have this conversation of, like, looking at that menu, what's the least destructive thing that I can eat? And instead of trying to rid McDonald's, which is never going to happen, they're way bigger than, more money than we have. Could we develop, if you have to go fast food, we encourage you not to, but here's the most healthy, I don't know how we'd put it, but here's what you could eat at McDonald's or Arby's or Wendy's or something like that. pick the things off the menu
Yeah.
that won't kill you
This
as
versus that.
fast
Yeah.
and do that. So people are like, that I can work with because you're not going to stop me from going to McDonald's.
Okay,
Can-
thank you.
Yeah.
Thank you.
Yeah.
Yeah. Great ideas.
I would like to also say that seeing diabetes farther down is also an indication of the research that we've done and the the medical health care that people are getting because diabetes is more controlled and it's not fatal like it maybe used to be. So with your talk about, continuing the research and with your talk about prioritizing, this is an indication of what we have done and what we still need to do. So, there's all aspects of it. And to talk about food and availability and food deserts, it's such a complicated issue. I think that your idea about McDonald's is pretty limited as to what we could do with that. It may be something we could do, but it's a very, very complicated issue.
Mhm.
So as a master gardener, I'd like to see everybody grow a pot of tomatoes on their porch.
Yes.
I'm just saying.
Yes.
So,
And-
okay, so you have some more for us. Obviously, I'd like to also say that we here are digging the data.
Good, good. Okay. So,
We're liking it,
Great.
so.
well, stay tuned then. We got plenty of data. So
Mr. Shepro, would you use your microphone so we can hear your question too?
How far back do our historical records go on these kind of statistics?
quite a ways. Do you?
The 90s at least, if not the 80s.
Not the 1890s or the 18.
Oh, no, sorry, 1990. And I should say internal data sets. The death statistics nationally go back.
We had the data, you could even get it to 1940, but CDC Wonder is no longer available.
Mm,
Mhm. Yeah, another cut at the federal level where
Yeah,
we're
and-
losing access to some of this information.
CDC Wonder is another, it's the same data, just from the national level. So you can break it down by county and state. They do censor some of the smaller cell sizes to protect identification or potential re-identification. And that is one that we do use when we don't have access to the most recent data. So.
But internally, I think at least to the 90s.
Mhm.
Great question. So transitioning, and this is a little bit, and again, Mr. Young's asked about chronic disease in the past. So we currently at the Kane County Health Department aren't funded to do chronic disease interventions. So we do, well, I should say we have a tobacco program. So that certainly is a chronic disease. About 17 years ago, we launched Making Kane County Fit for Kids. I just did a little screen grab from the website there. You can see the website is makingkanefitforkids.org. So this is something that the Kane County Health Department started. We brought on funding partners. It was a funding collaborative, meaning that organizations would pool their money. So we would give up a little bit of authority in how those dollars were spent by joining this more collective, larger amount. We eventually spun this off as, instead of it being a health department program, we launched it as its own 501c3, as I've talked about this in the past. This is a model I like, where we don't just keep something a government program, but we put it out there in the community. So we're still very actively engaged. You can see across the banner there, and this, if you're on the website, it's actually a rotating banner. You can see the different organizations who are committing funds to this on an ongoing basis. Over the past 15 years, we've given hundreds of micro grants to community organizations to change their environment. So it may be putting salad bars in schools. It may be building. We gave one of the first grants to the Western Avenue School over here in Geneva, and we're like 0.0000001% of the tremendous success of that garden over the past 20 years, because it's amazing to drive past. But we were excited 17, 18 years ago to give a grant to a school who said, hey, we want to start this cool community garden. And that's what we try to do with Fit for Kids, is how can we be a catalyst? How can we provide a little bit of funding that can help make a change, not only in the environment, but hopefully it's a policy change perhaps that can be supportive too. But today I just wanted to share a little bit We support what traditionally was called Walk to School Day. Now it's Walk and Roll to School Day. It is typically the first or second Wednesday in October. So this just happened on October 8th. Again, you can see this is a 501c3, but the health department's still an active partner. The organizations who provided funding to support this through Fit for Kids, we actually provide stipends to all the schools who participate. Kane County has traditionally been the county with the highest participation in the state of Illinois. And this is I want to be clear here because I'll push against my staff on this kind of thing all the time for these one-day things. This is an awareness building event. So we are using this and we collect data from all the schools who participate, but we're trying to raise awareness about safely walking to school, safely riding your bike to school, just taking a step back. And I've talked about this before, even in terms of behavioral health and personal development for kids, because we live in such a car-centric society where we put our kids in the car and we drive them to this, if we have the resources to do that kind of thing. There's research out there that shows kids don't have the opportunity that you get walking to school where you're deciding, am I going to cut across that yard or not? Am I going to jump this fence or not? My friend's going to throw a rock at that car. Am I going to participate in that or not? We're taking away a lot of opportunities for people to, I mean, maybe the throwing a rock is a bad example, but typically those are good decisions to test yourself and to grow. And when we just put a kid in a car and take them to, and we may be taking them to great activities, but we take that away. So there's a lot of positive things, not only for the health to be physically active, and the brain research on moving before you engage in cognitive things is very clearly studied, and with brain scans and test score results that show being physically active before you engage in learning is very positive. So we had a great turnout again. Over 60 schools participated. This is for elementary and middle schools across Kane County. I just took a couple things from our social media. So West Aurora on the left, we asked people to submit pictures and again, sign. In Batavia over on the right, I thought that was just kind of clever. They had a little chart with dots where the kids could go, and you would put the dot in the quadrant. Did you take a car? Did you walk? Do you ride a bike? How do you usually get to school? But it's an interesting way to raise awareness. We have St. Charles on the left, Geneva in the middle, Elgin in the right there. Every school district participated. You can see from the photos, we have mayors walking to school. We have some mayors who've been walking to school every year with the kids. We have fire trucks that go in parades. We have police departments. We have mascots from the schools, Kane County Cougars. It's just a tremendous day. And again, this is to raise awareness about the benefits of being physically active and walking to school. This is open to any schools who are in Kane County districts. So just a really positive thing for people to engage in. And again, I always like to think, and I don't know how we do this, but I think 2009, I think was the first time we did this. So I think, okay, so those kids are like 30, right? 25 maybe. Yeah. So who first started in it, and not to presuppose that this is life-changing, but it helps us to identify areas where schools say, we don't have bike racks. Okay, Fit for Kids can give a grant so that you can have bike racks. We have kids who want to do it, but we don't have access to helmets, or you know what, we'd like to work with the city to get a stoplight or a crossing guard. So again, we can work to be a catalyst for that. So really exciting, happy to share. Again, even though this is a 501c3, so it's separate, Kane County still invests. Kane County Division of Transportation is an active member. We each put $10,000 into Fit for Kids each year, and then other community partners do as well. And we'll typically give out between $50,000 and $100,000 in grant funds each year. So exciting. Any questions I can answer about
I
that?
would like to also add that another benefit of this that you did not mention is community building,
Yes.
because the kids learn who's in their neighborhood, you know, who they live by, and they, you know, that's another really good benefit of
Yes.
this as well.
Yeah,
So,
excellent
yes, Ms.
point. And
Juby?
can I just add onto that real fast? Same with your comment about the gardens. Community gardens are tremendous. Crime is down where there's community gardens. Intergenerational learning is up where there's gardens. So yes.
I just wanted to put a plug in for your little 0.00000 contribution to that. The Western Avenue Garden is used not only to feed, it's also used as a classroom, and not just a classroom about food. It's a classroom about all kinds of things. And if you wanted to create this again, they made the Farmer's Almanac. And so you can go to the Farmer's Almanac and you can search for the Western Avenue Garden in Geneva, and it will give you the dimensions, the type of soil that's there, and the entire list of plants. If you wanted to take that information, they did it through the love from Jay Womack, who is a part of the Geneva Natural Resources. He donated so much time and so many things to make sure this was viable, but the buy-in from the community is great. And these kids are so proud of this garden. So thank you for your little 0.00000 contribution. And for everyone that you do, understand that even though it's just a tiny bit of seed money, it's huge in a community. So
Seed money is a good.
it's, well,
Yes, yes.
I did that on
Wow.
purpose. So
I knew,
thank you.
I knew. And I would also like to say, as a master gardener, gardening can teach patience. Boy, can it. So, so
Ver-
this is all good. And we never know when that seed money and how it will grow and what the benefits eventually will be.
Yeah.
So this is great. And thanks for sharing these pictures.
And we have lots more. So I have a list here with the walk to school with the infant mortality. So this is, I think we'll have a no problem filling our agendas for the next year. Definitely. We have lots to talk about. So I want to transition a little bit now, and I want to ask for your feedback, and it can be today or you can think about it, but I want to start looking and Mr. Gripe, some of your comments as we talk about files and what are we doing. So we're unique at the health department in that we have over 30 cost centers where we have funds. And as I mentioned, every grant that we get has a set of deliverables, it has a timeline, we have a work plan. So when we talk, even, and I see it under new, but even as we talk about what are the goals of the health department, we have explicit goals for individual programs. As I've looked at what we've shared or what we haven't shared in my tenure as director, I feel like we're under sharing, but again, I'm mindful of long meetings and huge packets. So I'm going to go through some slides today. We can ask questions and we can talk about them. But what I would really like to get out of this is, are these the types of things, and I don't have to include them in a PowerPoint, but is this the type of information that you would like to see in a packet? Know that it's always available, even if you don't want the packet. So again, I'm not looking to make the county board packets bigger, but here's information that sometimes in history we have shared this more. So I'll just go through opening and closing of food establishments. I think this is kind of interesting. So you can see what's happening. It may be things happening in your district. So that may be of value. And this is, I'm focusing today on environmental health and communicable disease. So items that are under Director Onwuda. Looking at some of our productivity statistics for our environmental health programs. Is this something you'd like to see? So how many inspections are we doing? What's happening with temporary events? What's going on? There's a lot of work for us to do when a place opens. There's a lot of work for us to do when a place closes. What complaints are we getting and investigating? So is this type of data of interest to you? Looking at our lead program on the environmental health side. So what cases do we have? Certainly lead poisoning, and we've just lowered the threshold for cases that we identify. Is it interesting for you to see? And as you look at these, is this something, and it's, certainly the committee's pleasure, we could say, you know what, rather than seeing this chart with no context every month, maybe just once a year, you come in and do a presentation and share the highlights with us, right? But I'm interested, what would you like to see on an ongoing basis? Looking more at wells and septic systems. So this keeps us very busy. We still have, with the large amount of unincorporated land in Kane County, we have a lot of wells that people are using where we're issuing permits, abandoning or sealing, assuring that Abandoned wells are sealed, following up on complaints. This is just an example of some detail we have around nuisance complaints. So you can see the type of open burning, motor vehicle that's left on the property, overgrown, failed septic systems, open burning. So just to know the types of things that we're dealing with on an ongoing basis. Is that something that's interesting? Or I'm always interested for you in your district. Is there more? Frequently, you may even be the source of some of these complaints as we get them.
Juby?
Not that you're the complainer, but you bring it to our attention.
We get, from our zoning department, we get a list of, is it cross-referenced?
We work
with you?
together with the development.
Okay,
team.
so
Yeah.
we already get this.
This particular slide.
Well, no, it doesn't look like that. We
Okay.
get it broken down by districts, by what it is and things like that. So I don't know that I would spend a whole lot of time
Right.
on that because we already get it in a pretty digestible fashion that's pretty easy to understand.
Yeah, I think, I agree. I agree with that. You can pretty quickly see what's going on in your own district, but also what's going on in the county. So-
Excellent. Okay, very good. Okay, very good. Thank you.
Yes, Mr. Roth?
One suggestion I would think we should try to do is maybe have a dashboard
Yeah.
where people can drill down. And like this is an example of drilling down on what development publishes. And then over the year, maybe highlights different sections
Mhm.
to refresh our memory. Oh, I don't need to wait for a meeting. I can go look at it myself. But you got to market it to the board members because some of us have short-term memory, some more than others.
No problem. Yeah, and we're looking at developing more dashboards. So I
Yeah.
think that sounds excellent.
You know, and find good example. I always tell people when I do websites, find a good example of something you like.
Right.
And then you appropriate the idea, you don't steal.
Right.
So.
And think about, or
Go ahead.
oh, I was just gonna say, if there's particular areas of interest, we can include things in the packet. We can summarize, we can condense. My natural leaning is to provide less information and focus on the more important things, but that's subjective. So if you are somebody who has interest in these areas, as my boss, you tell me so that we can provide that information to you, whether it's in the packet or separate. We're happy to do that as well.
And here's one example. I know you have multiple websites. We need to have somewhere on your home page that lists them all because, we're writing down a lot of times, oh, that one and this one,
Yep.
and you lose that scrap of paper. It'd be nice, like I know our county website is not very user friendly and it's easy to get lost in.
Yeah.
And, and it's the hard thing to do. Because you don't want a techie doing that because they have no clue on how to make it user friendly.
No, I think the best thing is to test it with the audience. And in this
Right.
case, you're the audience. So
Right.
you tell me, but yeah, great comments.
Any other comments? Okay, I think we'll do some thinking about that and get some information back to you. I think obviously this group really enjoys the data.
Good.
Whether or not that's something we want to put out for every packet or on the website for everybody.
Sure.
That's something we should, that's what I'm thinking, probably
Yeah,
not.
yeah. Okay, I
but-
just want to affirm. That's good.
Yeah.
And I've got 2 slides here with communicable diseases. It's interesting. And it could even be something we mail to you separate from the packet if you're somebody who loves this stuff. So just yeah. Yeah. There's a lot of chlamydia out there.
No kidding.
Yeah.
If I may, Madam Chair.
Yes,
So what do we do about that? I mean,
We have whole programs that are
Yeah,
working on it.
it's-
Yeah.
yeah, it's a big issue and it's getting to be a bigger issue.
Yeah.
So I'm just curious.
Yeah, I think we're exploring even digging into have an STI clinic perhaps at some point in the future. But right now, and I'll defer to Director Onwuda, we spend a lot of resources on this currently.
I think right now, the most important thing we do is to make sure that those cases are properly treated. Because many times even some of the providers don't know the right treatment for them because we're having issues now with gonorrhea and resistance to antibiotics. So making sure that they're properly treated is one of our top priorities. And then working with Open Door Clinic and other providers in the area to make sure that we're contacting, the contacts of the cases, to treat them as well.
And again, my kind of overall, when we talk about this, and it goes into your comments about infant mortality too, what's the agent? What's the disease, right? How does a person get it? So what are all those risk factors? How do we protect other people from getting it? So this case, which is not always the case in public health, as Director Unwood has said, treatment is part of what we focus on. A lot of times, if it's heart disease, we're not focused on treatment. We're focused on prevention and things like that. So partner notification, making sure that there's education out there so folks know what the risk factors are. Depending on what the agent is, and actually, if I go, and this, I was just giving you examples, so this is not to analyze it. So I appreciate you can't read this unless you really have eagle eyes. But each of these diseases may be spread differently, right? So some things you may get from touching something that somebody else touched, and then you touch your nose or your mouth. Some things, like the previous slide, come through sexual contact. Some things you may get from food. Some things may come from water. Each of those have different interventions, and we have and I always say it's our unsung heroes. We unfortunately, literally, they're in the basement with no windows, working on calling people all day. They don't get the exciting photos. They don't get the exciting presentations that we do, but they are doing such critical work to stop the spread of disease in our community.
And I think that's another thing I would like to say. I learn all the time how much more the health department does than what I realized. And it's so comprehensive. And I think it's always interesting to see what your scope of work is. So I enjoy that. Yes, Mr. Pennises?
Thank you, Madam Chair. I know nationally STDs are tending to go to older adults. Are we seeing the same thing here in Kane County?
Depends on which one. We still have young people with chlamydia, gonorrhea, syphilis, some older people. But it has nothing to do with age.
Well, absolutely. But I'm saying, like, with prevention and awareness campaigns probably aren't focusing on,
Yes.
seniors, when actually that's the growing area.
But
for
the
it,
anecdotal nursing home outbreak, or
Right,
yeah,
right.
sure.
Yeah.
It's
Mr. Gripe first?
Yeah, thank you, Madam Chair. Good point, Ted. So my question to you, Michael, was going to be that previous chart. 100% of that top section is preventable. 100%. We all know how, but outside of, whatever. Any rate, I was wondering, this is important information. Can we get this into schools? And I'm, like elementary schools and things like that, middle schools, to retirement communities. Just, we don't like to have to talk about that, but if we don't tell these kids and older people that, here's what can happen to you, and these things are becoming more and more resistant to treatment. So I'd love to see us getting it out to the schools and retirement communities, as Ted suggested, to try and reduce it.
Great.
Mr. Roth?
Roth here. Cheryl, I'm following up on a comment you made. We're always learning more what the public health, and we've talked about that over the last few years. And I think one way is doing short videos. Do you guys have a YouTube channel?
Yes.
And you want to keep them short. A half an hour we're not going to watch,
Right.
but a 3-minute one or whatever, like, the life in a day of, one of the people down in the basement.
Yeah, that actually we have underway now, where we've been working on videos, both for internal onboarding of new employees and for public education.
Right.
And I know, and my kids are older now, but if I would show them a video, say 10 years ago, the first thing they do is they touch my screen. And if it's like 45 seconds long, they're not watching it.
Exactly.
Right. They're like,
And you
"No, I
got
don't
and you
have
got
time
to
for that."
add some humor to it. And I'm starting to get up the learning curve on doing videos, because it's a good way, especially for younger kids, on communicating,
Yes.
And older kids.
Yes.
and older kids too.
When we saw, and this is a mixed thing, and I just want to really go on the right, social media is, in my opinion, based on the research, the number one thing that's detrimental to our mental health in our community.
Right.
And it's the number one way we communicate with each other. Right. So it's a double-edged sword.
Yeah, exactly.
Mr. Penesis?
I think you may have mentioned this, but you're doing some digital advertising, countering that social media effect. There's digital ads that you guys are doing too, because I think that's very effective. It reaches the people you want to reach for the most part. Obviously, you're not going to reach all the people and you're going to reach people that you don't want to reach, but that's an effective way to address that problem is digital advertising. You guys are doing that, right?
Right. Yeah, we have some great things going on right now with our mental health intervention where we have videos not only of our team, but also community organizations. I can bring some samples of that, but with people talking about what they're doing with the funding that Kane County has given them to support mental health. We had the very powerful presentation that we did around overdoses where we had folks come. They did really tremendous videos, but then they came to the committee meeting and people talked about loss in their own families or how they have succeeded in getting into recovery. So I think those really, it's personal stories about Kane County. And I think even though I will push back a little bit on oversimplifying that it's an education-based thing. So I'll push back on Mr. Gripe on that in terms of efficacy. But the nugget is this is here and we're all stubborn as heck. So if I talk about, oh, well, did you know in Europe this worked? Well, I don't care about that. Well, did you know in New York this worked? I don't care about that. When we talk about our residents here and we share our stories, and that's for any health topic, now I'm listening. Right now, people we see are more likely to listen and not trying to be funny. If you add a cat or a dog to it, people pay a lot more attention to. And we track our social media, so that's actually a fact. But localizing it is really effective. That's a great way. And having the videos. We've been slowly building into that. That's been something that we're building our expertise in.
Well, I think even the rock and roll, they have the local pictures that, people love that. They,
Yes.
oh, do I know that kid or whatever, or I know that building or whatever. So I think the locality and focusing on that is really good.
And I'm a little shy with the presentations here at the committee level, but I can send you links because we've been and Mr. Peters in the back knows we've been flagged by YouTube. So sometimes we put our videos on YouTube and then because these meetings are broadcast on YouTube, if I show YouTube videos on YouTube, sometimes we can get a red flag for showing information. It's not copyright, but we've been flagged before for showing our own videos. So we can navigate through it. So I've kind of held back on that, but actually for the walk to school day, Tina Corral, who's our health promotions manager, did a fantastic job. And all of the community organizations that submitted videos. So there's a lot of great videos on the health department's Facebook page, on Fit for Kids Facebook page. And again, we're two organizations in this case. So they have their own identity. But there's great videos where you can really see the kids engaging. So yeah, excellent idea. And quick note for COVID, we found that in the Hispanic population, there was national studies that showed YouTube videos were identified as the #1 place where people were getting their education. So as we talk about how to reach people, video is definitely where we need to put more resources.
Wow, lots of good information this morning, lots and lots. So anything more you want to tell us about this morning?
I think, yeah, I've probably bludgeoned you with enough. I figured I'd end with this one where it's like 6 fonts and 40 lines of things. So let me know, feel free to reach out to myself and Chair Strathman and just let us know. Cause as I look back, and I did look back over the past 25 years or so of public health committee packets, and we used to provide a lot more information, but then people didn't seem to be looking at it. And again, my bias is to provide less and focus on what we think. That's part of what you pay us for, is to focus on what's most important. But I also have a feeling that we're not sharing enough right now. So I just kind of want to strike that balance and re-engage with you all about
So
that.
input on that would be really great for us to help them make that decision. So.
And just a huge shout out to our team. There's, as we've mentioned, people don't know, there's a saying that when public health works, nothing happens. We have such a great team at the health department who are working and protecting people and helping people in need. And their stories aren't often told. We can do a better job of that, but just we're really fortunate to have the great team that we have at the Kane County Health Department, helping in a whole variety of different areas. So.
And thank you for that. Thank you all for that. Okay, anything else with that then today? So we'll be gathering that information and passing it on, and so we'll go from there. So, any new business? Yes, Ms. Juby.
My new business ties to item agenda A, which is the committee goals review. So are you looking for new business outside of that?
No, we can do both. So
Okay.
any new business besides that?
So I have
first?
nothing beside that, but I have things for that I would
Okay,
like to
then let's proceed to
contribute.
that.
Oh, okay. we
Right
can do
ahead.
that. All right. So when I was looking at the committee goals that we had for this year, two of them kind of stood out to me. One was the protect people from health problems and hazards. And I think that that's not really something we can do, but I think that if we used data informed practices to help ensure a healthy constituency kind of a thing like that, kind of go from the from how do we use data to drive healthy outcomes, and that goes into the next one, which is enforce public health laws. But we don't enforce; the health department enforces, but we educate. So I think if we took an education standpoint and it was educate the public on the health laws, there would be a whole lot less enforcing that had to happen. Because, well, or maybe not, maybe there'd be more enforcing, but I think that we as a committee have the ability to educate but not inform, unless you guys are going out with your little enforcing things at night with your flashlights. I just think, I mean, which would be cool if you're doing it, call me, because I would love to do that. But
Me too.
but I think it should be more toward what we actually as a committee can do. And seeing how Michael was so kind as to introduce the idea that he may be willing to give us much more data that's in context, because data is data, but it can be used multiple ways. So if he's willing to do that, I think that our goals should kind of reflect the data and information that we're getting from them, which then kind of gives them guidance on how to do their job, because they kind of do report to us through some weird county's code. So
I think that's some very good information. Would you send that to both Michael and me?
oh yeah, you don't want me just to leave you this little scratchy pad and then yeah, I will do that.
Yeah.
I will do that. Yes.
For
And
those
you'll
of
have to like work on the wording, because
But that's a
we want to,
really
we
good
want to
start.
make sure that when we put them down, that we can get a deliverable out of the goal. And so that's not maybe my strength, but you guys are really good at that. So yeah, I will send it out to both.
But for those of us who are visual learners and that auditory.
Well, that would be me. So yes.
All right, great. Any other, yes, Mr. Shepro?
To Ms. Juby's comment, I think the state's attorney's office would discourage board members from going out with flashlights to enforce the health laws in the middle of the night.
You're such a fun suck, Ken.
Probably. Mr. Roth, you had something to add?
Yes, I had introduced back in May. I think we need to start having our goals be SMART goals, where we're challenging ourselves a measure, it needs to be measurable. And you don't do easy goals you meet in a month. You do stretch goals, and you may not meet them, but that's okay, because we're never going to improve if we don't. Some departments have goals that are a page long, and it's not worth the paper it's printed on if we're not improving.
I have heard you say that several times.
And I have a good article I could pass on.
Well, I am familiar with SMART
Yeah.
goals, and I've done a little research, and SMART goals are not always the best way, because it's more for a tactical approach. When we're setting principles and goals, strategy, it does not always apply, because one of the T of SMART is
Right.
time bound.
Right.
And we don't want a time element on, we want ours to be ongoing. So
And-
the
and I
SMART
agree.
is a great framework to look at and to have it as a suggestion, but there's more to the kind of goals in this committee that we do, but it's a great place to start.
Yeah, and I'm not saying it has to be 100%.
Yeah, but it is a great place to start. So, and if you're not familiar with SMART goals, it's specific, measurable, was achievable, relevant, and time bound.
Right.
That's what the acronym for SMART is. And you can see that they would not always apply when we're setting our goals for like the health department, but it's a great place to start.
Yeah, and I found a good article last spring that gives examples. Because sometimes it's hard for people to envision,
Yeah,
how to do a
yeah.
SMART goal.
And it's pretty available too, but it is a great place to start to give us some ideas.
Yeah,
Yes, Mr. Pennises?
I totally agree that it's a great framework. And like Bill said, we don't have, it could be marked goals or, you could eliminate the S, but that's a good framework to
Yeah.
shoot.
Yeah.
So.
Yeah.
Yeah.
Yes, Mr.
A comment and a
Pennises.
question. We typically will use goals and then SMART objectives. So a goal, and this is semantics, and
Yeah.
they're both perfectly widely acceptable. But that a goal may say we're going to reduce heart disease, and then the objective may be we
That's
are
correct.
going to decrease the amount of time it takes. That's actually SMART, right? That's measurable and time bound. But a question, and this is very interesting to me. We had envisioned these as kind of what the health department does. So if we make it SMART, I'm curious your comments about this being committee goals, which it says committee goals. That is a different thing. And so I'm keenly interested in that conversation. And that may actually be easier to measure. What are we doing here? Right. And whether it is, I mean, well, I don't want to jump ahead, but
I agree with you because until you said that, I was thinking of the health department goals. And I think it does say committee.
It's a big
So I think
difference,
that's a
yeah.
really good point. I'm glad you brought that up. And I think it
Thank you.
it really is the work of the committee. So I think that's a very good point. Did you have something else?
I
to add?
did. It just kind of that, all about SMART and everything. It basically comes down to deliverables. And can we, what is our objective and how do we measure that we've reached it? We measure through our deliverables. Did we get it or did we not get it? Which to me is much more concentrated in this type of a thing. I mean, because the people that report to us have they have way more laws than we do. They have way more things they need to track. And so I think if we break it down to, what is our part and how do we measure that we're doing our job, which of course sadly affects you, but I think that that's just easy. If we just remember, if we have a goal on there that we have no way to do, it's not really a goal.
Well, in
So-
fact, in preparing for today, because I was thinking about this, I looked up the definition between vision and goal. And I think that this is where we're walking a foot in both sides of this, because a vision is a long-term overarching description of a desired future state.
These are all.
And what a goal is, specific measurable targets or milestones. So you can see where we're kind of doing both. So I think we need to do a little thinking about this and decide exactly what we do. But I do think it would be a good idea for us to think about doing it as committee goals rather than health department goals. Because you know so much more than us anyway, and do so much more than us. So
yeah, but that does help feed what do we need to give? What do we need to be bringing each month? So that we can
exactly,
accomplish these?
exactly. So that's a very good point. Thank you for doing that. So, okay. Wow, you guys are the best, just the best. Okay, any other new business? No? Okay, then I'd like to ask for unanimous consent to place the reports on file.
Genesis moves.
And second? Oh, is that unanimous?
Unanimous.
consent?
Unanimous consent, sorry.
That's
Genesis moves for unanimous consent.
Okay, okay. And so, we have added chairman's conflict or comments today. And I just wanted to add that, at this time of conflicting information that is coming out, that what people should do is if they have question is to contact their own healthcare provider to get their questions answered. I think that's the best information to pass along. So, we have just a minute left, but I'd like to ask Mr. Shepro if he wanted to share with us his historical data for today.
Thank you. 250 years ago today, Peyton Randolph, who you may have heard of, was a early patriot, died in Philadelphia, and the province of Delaware reelected their 3 representatives including Caesar Rodney, who is on the quarter for Delaware, having been ridden all night later on the following year, riding all night from South Delaware to dramatically enter the hall in Philadelphia in time to break the 1-1 tie of the Delaware and vote yes for independence.
Right.
So,
All right. Thank you for that.
and King George addressed both houses of parliament and declared for the first time that the colonies were in open rebellion.
Oh, okay.
Strong letter to follow.
Thank you for that, for sharing that. Okay, so I'd like to ask for a motion and a second.
Roth will make a motion for adjournment.
Second,
Juby seconds.
and